This is a condition of orbital cellulitis. This is an acute infection of soft tissue of orbit behind the orbital septum. It may or may not progress to subperiosteal abscess or orbital abscess. Etiology of this condition, it can be caused due to exogenous infection or endogenous infection. Symptoms of this condition can be moderate to severe pain, lid swelling, redness, moderate loss of vision, and patient can complain with fever, nausea and vomiting. Signs of this condition can be marked lid edema, conjunctival chemosis, protrusion of eyeball axially, mild to severe restricted ocular movements, congestion of retinal veins, and signs of papillitis or papilledema. Investigation for this condition, we can go for a bacterial culture, complete hemogram, an X-ray, an orbital ultrasound, and CT and MRI. Treatment of this condition, intensive antibiotic therapy, analgesic and anti-inflammatory drugs, and surgery can be advised. For daily updates, subscribe for iCare Optum. Tata, bye bye everyone.